Now, from the global resources of ABC News.
For the first time on national television, Drew is showing us the future of liposuction.
Now this is the ZERONA laser, and this achieves what we consider to be the holy grail of plastic surgery.
ZERONA. What it is a laser, a cool touch laser. It doesn't burn the skin. It's used on the outside of the skin to melt fat.
ZERONA, Z-E-R-O-N-A.
There's no pain, there's no downtime, there's nothing. Folks are losing around 4 inches off their bodies, but here they've seen some people losing around 11 inches.
It works.
This is see it, believe it results.
And look at this, is incredible. This is the kind of thing that you just dream about. I'm ready to do this.
I'm sorry.
No. I'm doing this. I'm doing this. ZERONA, my ZERONA, here we come.
What's going on?
Hello, and welcome to Zerona Corporation. Thank you for your interest in ZERONA. In this video, I'm going to be covering information about our ZERONA medical laser. The ZERONA is an exciting new product clinically proven to emulsify fat tissue. We will be covering the science behind ZERONA and how to properly utilize the ZERONA on patients to achieve optimal results. The ZERONA, manufactured by the Zerona Corporation, is an innovative approach to circumferentially reduce unwanted inches without the risk of serious side effects. The ZERONA is the first and only non-invasive body slimming device to be clinically proven in a proper Level 1 clinical investigation. With that, ZERONA practitioners and facilities can feel comforted knowing that the treatment they are providing to their patients has been properly tested. These studies, however, do not originate with the 67-patient Level 1 study. In fact, an extensive body of histological trials have been performed to fully understand the effect the ZERONA has at the cellular level. Studies which have provided the scientific foundation for this unique therapy. The ZERONA operates under the principle of photochemistry, a discipline of science that does not produce a harmful environment on the cell, but rather uses light energy to safely influence complex reactions within our human cells. And the fat cell is no exception, but its unique response following light is what makes the ZERONA histological evidence reveal the creation of a small pore within the protective barrier of that cell, allowing the stored fatty material to leak out of the cell, causing that once voluminous cell to collapse. This is the fundamental principle of the ZERONA, working synergistically with our fat cell, causing its collapse, rather than using unsafe, inappropriate technologies to destroy this important cell. Once released, the fat is easily absorbed by the body and is broken down into safe components known as fatty acids, which can be used to produce energy. Overall, the ZERONA supplies a treatment that is safe and effective. Let's now discuss the effectiveness of the ZERONA. In order to assess whether a device is capable of having a clinically meaningful impact, it must endure the rigors of a placebo-controlled, randomized, double-blind, multi-centered clinical study where the physician and the patient are not sure if they are receiving the real treatment or not. At the end of the study, we are capable of comparing the results of the placebo group, not receiving the actual treatment, versus the real group, which received the ZERONA treatment. And in the ZERONA trial of 67 subjects, the real group exceeded the placebo group by almost 3 inches in 2 weeks across the waist, hip, and thighs. That's right, inches in just 2 weeks. The ZERONA is the only product that has been clinically proven to reduce inches in that time frame. In order to achieve results like the clinical trial, we must adhere to some important standards. When positioning the ZERONA over a patient's cosmetic troubled region along the waist, hip, and thighs, there are 3 important standards that we must ensure are properly followed when adjusting the ZERONA. First, ensure that the laser diodes are properly positioned over the skin no greater than 8 inches, meaning 8 inches is the distance a diode can be when placed above the skin. To maintain proper distance between the diodes and the treated area, we highly recommend the utilization of the Z-stick for proper measurement. Second, the metal housing plates of the diodes must be parallel to the region or plane of skin being treated by the individual diodes. As you notice, the diode heads can slightly rotate. Therefore, you must pay close attention to ensure that the heads are rotated so that the metal housing plates are parallel to the skin, thus enhancing depth penetration. And finally, to enhance surface area stimulation, the line-generated beams must overlap their adjacent counterparts. Now, the overlap does not occur between the brightest, most concentrated portions of each beam, but rather the faintest regions. This ensures that light energy is being delivered in between identified regions of greatest subcutaneous fat, but ensures that the center of the beam remains over the highest accumulation of subcutaneous fat. Maintaining these 3 principles are key and will tremendously help to ensure that your patients receive and achieve their cosmetic goals. What is also important is the adherence to the clinically proven protocol of every other day for 2 weeks for a total of 6 treatments. It is acceptable to treat Monday, Wednesday, Friday, or Tuesday, Thursday, Saturday, but no greater than 48 hours can pass in between treatments. Therefore, any protocol outside the Monday, Wednesday, Friday, or Tuesday, Thursday parameter is a deviation, and results cannot be guaranteed. Further, the treatment must be administered for a total of 40 minutes, with the front and back side receiving 20 minutes each. Again, it is important proper placement of the diodes occurs to maximize patient response. The treatment protocol of 2 weeks, every other day, for a total of 6 treatments was clinically proven. But if a patient wishes to receive more, it is acceptable to provide more treatments. For instance, every other day for perhaps 3 or 4 weeks is acceptable, but it is never acceptable to treat less than 2 weeks or attempt to provide all 6 treatments in a 1-week time frame. The protocol is based on extensive research, and to deviate from the established protocol may result in patients not achieving their desired cosmetic goal. So please, adhere to the set protocol. Regarding a good patient response, who then is the ideal candidate for this procedure? This procedure was designed not to treat the extremes, meaning it was not designed to treat very thin individuals struggling with small pockets of subcutaneous fat, nor was it designed to treat individuals with large regions, including those with body mass indexes exceeding 35. This procedure was designed for patients with a BMI between 20 and 30. These are patients that have implemented lifestyle changes and are unsuccessful at resolving those troubled areas. ZERONA can be the tool to accelerate their slimming and provide the physical changes they determined to achieve in a fraction of the time, providing them with the confidence and motivation. I hope this video has provided additional insights to the ZERONA and its benefits. Thank you for your time.